And now let's begin today's discussion by talking about the CDC, which just a few days ago, they made, you can say, a very significant change to the data that they've been reporting in regards to COVID. The CDC very quietly removed tens of thousands of deaths which were officially linked to COVID, including nearly a quarter of the COVID deaths that were listed for children under the age of 18. And by quietly, well, I do mean really, really quietly, because if you were not dialed in, if you were not keeping a close watch on their data tracking website, well, you would have likely not even noticed it at all. It was that quiet. And the best part, at least in my opinion, is that after this discrepancy was discovered, the CDC put out a statement saying that the reason that they had to quietly scrub tens of thousands of deaths from the official tally was due to a coding error. Here's specifically what they wrote, quote, "Data on deaths were adjusted after resolving a coding logic error. This resulted in decreased death counts across all demographic categories." Now, let's go through the actual change in terms of numbers. Prior to March 15th, meaning prior to this alteration, the CDC listed 1,755 children as having died from COVID, as well as approximately 851,000 adults. However, after the change was made on March the 15th, the number of children's deaths was cut by 24%, down to 1,339, whereas the number of deaths among adults was cut by about 8.3%, and it was brought down to approximately 779,000. That means, in total, overnight, this change by the CDC wiped out about 72,277 deaths from their official tally. Which is very cool, because you might have assumed that only people like biologists, scientists, as well as medical doctors could defeat COVID. But it looks like statisticians could be utilized as well. Now, besides placing the blame on the coding error, we here at the Epoch Times, we also reached out to the CDC in order to get a comment on how this could have happened, and one of their spokespeople got back to us saying this via email, quote, "The CDC constantly reviews our COVID-19 data to ensure its accuracy. The adjustment was made because CDC's algorithm was accidentally counting deaths that were not COVID-19 related. Our rigorous quality control measures help us identify when new information changes our understanding of data that has been previously reported." So it's great that these numbers have been lowered in order to correct the error. In the meantime, they have been used to both guide public opinion as well as public policy. That's because the numbers from this online data tracking tool, they were cited widely across media outlets all across this country, as well as by public experts like Dr. Rochelle Walensky, the director of the CDC, in order to push for things like vaccine as well as mask mandates. The point is that public policy, the debate surrounding public policy, it should be based on accurate data. If the well that we all drink at is poisoned, meaning that if the actual facts and the actual data that we're using in our public debates is not solid, well, then what's even the point of having those debates? Because we're all just guessing at what the underlying reality is and then just basing our guesses on top of more guesses.